my hospital name is NM Hospital, and we are located in Vesu. So here are the go to questions. The first one is, my last delivery was a C-section, but I want to have a vaginal delivery this time. What steps should I take? A vaginal delivery after a cesarean section is called a VBAC delivery. A VBAC delivery is actually not in our hands. So sorry to puncture the hopes, but the things that you can take care of is that the first thing is make sure that you want a vaginal delivery after a cesarean section. Second is choose your doctor wisely who supports and believes in the vaginal delivery after a cesarean section a lot. Second thing is that keep a very balanced diet, maintain hydration so that you don't put on a lot of weight, which would add on to the associated risks during the pregnancy. And exercise well, please. That will strengthen and help you a lot. Strengthen your pelvic floor muscles and will help you a lot. So the second question. I'm 6 months pregnant with borderline high sugar and blood pressure. What can I do to get in control so that I can have a normal delivery? You need to restrict salt, sugar, and fats from your diet so that you don't increase your BP, so that you don't increase a lot of weight, which will only aggravate this condition for you. Second thing is that you require regular antenatal checkups so that the doctor can monitor your fetal growth, as well as it can monitor as well as the doctor can monitor your vitals. Make sure you're taking medications properly. Make sure you're eating a very good diet and you're exercising well. And you need to have exercises that are under expert guidance, because there are a lot of exercises that with a full-term stomach you cannot do without any guidance. So the third question is, BMI is on the higher end. Can I have a vaginal delivery? What precautions should I take? Yes, you can definitely have a normal vaginal delivery, provided your healthcare taker, I mean the doctor that you're showing, is pretty confident about conducting a vaginal delivery for you. Again, the same things. Please exercise. Please make sure that you're having a balanced, healthy diet. You're hydrating well, and focus on not putting on a lot of weight, because a lot of weight putting on during your pregnancy increases a lot of health risks. So the fourth question is, how can I train myself for a normal delivery? Usually during the first semester, I would like trimester, not semester, sorry. During the first trimester, I would want my patients to walk a little post each meal. So just 10-15 minute stroll can help. Second thing is that right after you finish your first trimester, under expert guidance, you need to start doing a lot of pelvic floor training. The stronger your pelvic floor muscles, the better it aids during normal delivery, the better relaxation you have. You can take on the contractions very easily. Third is exercise and yoga do help a lot, because a lot of muscles, the balance of your body and the posture coordination change with the increasing size of the uterus and the weight of the uterus. So those postures need to be corrected. That coordination needs to be strengthened. So the muscles need a lot of exercise and need a lot of training before you go into labor. The positions that you can do for yoga is the cat position, the extended triangle position, provided it is under a lot of guidance. If you're starting fresh, please make sure that you have people to guide you as of what exercises need to be started. Start very slow and then gradually increase the intensity. The thunderbolt pose. All of those things can be done, provided it's under expert guidance. Next, what should I eat before the delivery? I'd say don't eat much. Initially, when you get your contractions, you do not face a lot of, you don't feel like eating. First of all, when you're having those contractions, you don't feel like eating, but you need to hydrate well. Make sure you're hydrating well unless and until you get admitted to the hospital. Keep your food a little light so that you don't vomit once you get admitted. Next, how will I know my labor pains have begun, usually during the last month, you have a lot of really mild kind of contractions. That is just to aid the baby to push it down. Those are called the Braxton Hicks contractions. The Braxton Hicks contractions are not the time that you need to come and get admitted. The time you need to get admitted is you're getting strong, unbearable pains at the this thing gap of about 15 or 20 minutes. So you know that those are really strong pains. While you feel the pain, your abdominal wall will become very, very, very rigid. It will become stony hard, and that lasts for a few seconds. Then again, the pain gets repeated 15-20 minutes after that. So that's the time that you need to come when you're a preemie. And suppose you are delivering for the second time and you've already had a vaginal birth earlier. So every half an hour or every 40 minutes, if you get a contraction, a strong enough contraction, you need to get admitted. Next. What can I do to reduce pain during labor? So yes, you can do a lot of breathing exercises. Focus on your breathing. The maximum you focus on your breathing, the lesser you feel the pain. Plus, you're making sure that your baby is getting enough of oxygen and nutrition. Do my previous delivery conditions or complications affect this pregnancy in any way? Yes. In certain conditions, yes. In certain conditions, no. So the takeaway message from all of this is, throughout your 9 months, you need to make sure you're eating a very balanced diet. In India, we have this tendency to feed our uh, mothers a lot. So make sure you're not doing that. You should restrict yourself from a lot of sugar, fats, and salt. You can have regular small meals, but make sure you're not putting on a lot of weight. Make sure once you get into your second trimester, you're exercising well and you're leading an active life in spite of being pregnant. You shouldn't be, a sedentary potato sack. Make sure that you're exercising well. And please, 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 any problems, make sure that you're speaking to your doctor. Do not self-medicate. Do not take advices from people who have had, see, every pregnancy in a single person also, every pregnancy differs. So make sure that you're taking advice from the doctor. Any small little thing, make sure that you're approaching your doctor. And all the best to all the mothers.